I'm excited to host this facilitated session today, but I wanted to go ahead and get us started with just a quick word of prayer. If you'll bow your heads. Dear Lord, thank you for all the time you have given us over the last 18 months, especially to consider what it is our work to do in this world. We've been isolated for so long and back together and back isolated, and we're frustrated. Please give us courage and guidance to help know the best way to bring about your will. In regards to the pandemic, thank you for giving us the blessings of these experts within our congregation, share their expertise, and give us the words that we would like to share with others to help bring this pandemic to an end. We love you, we praise you, and we thank you for your guidance. Amen. Okay, so I'm excited to introduce Whitney Thurman, who is a PhD in nursing and a registered nurse here in town, and Karen Smith, who is a family practice doctor and also a teacher at UT Dell Medical School, Baylor Scott and White, and Texas A&M. So they are our resident experts and have been really working hard for the last year and a half. And we're so excited to have them here. I wanted to let them introduce themselves more. Whitney, you want to go ahead and start?
Sure. Thanks, Emily, and thanks everybody for being here. So as Emily said, I am Whitney Thurman. I think I know most of you who are here, although I can't see everybody on my screen at the same time. I am an assistant professor of nursing at the UT School of Nursing. I teach public health nursing and do research on public health systems, care coordination, and whatnot. I do have specific experience in pandemic preparedness from many years ago, working for the Department of State Health Services, which has been interesting is a word for it, to now sit and kind of experience this alongside everyone else. I have also been really involved in vaccine efforts with the UT School of Nursing ever since, back before Christmas, whenever the vaccines first got to town, and vaccinating different populations over the course of time. And it has definitely become harder as time goes on. And so this just struck us as a great opportunity to maybe share some tips and best practices that we have learned over the course of the past 8 months or so vaccinating folks. I'm going to let Karen, you go ahead and introduce yourself now.
Hey everybody, I'm Karen Smith. I am a family doctor, and I do global kind of relief and primary care work. I work for Baylor Scott and White, and I do teach at Dell and at our family medicine residency, which is a joint venture of Baylor Scott and White and Texas A&M. So I train doctors, but my specific experience with this, other than with my patient care day in and day out, is more on the vaccine hesitancy side. I adore public health. I'm an amateur public health person, but I'm not an expert like Whitney. There's kind of a natural collaboration, though, that happens between primary care doctors and public health experts, because we're right there in the trenches and we can be great sources of information for leaders who are making policy. Years ago, I was a contract doctor at a large Christian ministry that had an outbreak of measles, and it was a very large vaccine hesitant community, and we had to get them all immunized within 3 days to stop the spread of measles all over Fort Worth through the homeschooling networks. And we succeeded. And that experience of working with culture in a vaccine hesitant population has never left me. So we'll bring some of that to bear as we're talking tonight about how to talk to people who have questions and concerns.
Yeah, and So hopefully y'all can see the slides here. I did pull together a few like PowerPoint slides just to help give us kind of signposts during the discussion, but we're really hoping to have this be more of a conversation. And there's definitely time like at the end for all sorts of discussion, questions, and I like to call them responses. I heard that in a podcast recently, because we don't really have answers, but we have responses to your questions. And so we'll have plenty of time for that. But as we kind of go through this content at the outset, please, if you've got a question about something we're saying, you can, unmute yourself and just interrupt us or use the chat. And Emily's going to kind of monitor that for us. And we will field those kind of as we go through and as it makes sense, because we do really want this to be as helpful as possible and, conversation to the extent that we can. So here we go. And somebody please let me know if my slides start doing something crazy. Okay, objectives. All right, just so that y'all know what we're hoping to cover for the evening is some tips and best practices. These are based on both personal experience and literature that has come out in the past 8 months or so, the scientific literature, in terms of words that you should use, shouldn't use when talking to folks who have questions about the vaccines. We weren't quite sure who was going to be in the room, and so we also throw in this objective number 2 in terms of suggestions for workplace policies and practices, because I know some of y'all might be a decision maker, or if you're not a decision maker, you might know a decision maker that can influence this within the work site. And we know that that's a good place to influence behaviors. And then the last one, of course, is to respond to questions about the vaccines or other COVID-related questions to the best of our abilities. All right. I need to be patient over here. Here's how we're going to do it. I'm going to give a broad, just one slide of where we are in terms of our vaccination in the United States, talk through some messaging that resonates, talk through the workplace policies, and then our question and responses. Okay, so this is data that was current as of yesterday afternoon from the CDC. This is for the United States. You can see the breakdown here of how many people by age group are fully vaccinated, how many are partially vaccinated, and how far we have to go. So right now, when we look at the population of folks who are eligible, 59.6% are fully vaccinated, but we've got 70% who have started that vaccine series. So we are well on our way, which is great. And so we've got, roughly 30% that we still need to really focus on. And we're never going to get to 100% of our population being vaccinated, and that's okay. We'll kind of talk about that a little bit, but we shouldn't focus on 100%. We should focus on one person at a time right now. Okay, and I think that this is perhaps one of the most important points of tonight's discussion is that of the 30% of people who are not yet fully vaccinated, they are not equivalent to being anti-vax. There are, of course, people within that breakdown that are anti-vax, and they're not going to be vaccinated against COVID. Many of them are also not going to be vaccinated against other diseases, that vaccine preventable illnesses. But that's not who we're talking about tonight. We're not talking about the conspiracy theorists and those who are just kind of hardcore, no, I'm not doing it. We're talking about what's called the movable middle. The current estimates are about 40% of the unvaccinated adults They're hesitant, but they are open to learning more. So that's what we want to do tonight, is talk about who those folks are and how we might be better able to talk to them, to answer their questions in a, you know, caring, empathetic way, so that they remain open to the possibility. If they're not yet ready to make the decision, they remain open. Okay, so I know this is a lot here on this slide, but this on the left hand with the pie charts, this is just kind of breakdown of, you can see here that half of those who were vaccine hesitant say that they learned or heard something persuasive. And then more than a third say they spoke with someone. So that means family or friends, you know, colleagues, peers that they spoke with, and that's what made them decide to get vaccinated. And from the same study, you can see here the list that I thought was really powerful, some of this in terms of what they learned or heard that persuaded them to get vaccinated. And so it's really just kind of seeing that others are okay. Karen, I'm going to pause here and let you jump in, if you've got, you know, with whatever kind of specific experience you've got.
Sure. So I've been doing this kind of 50% of the time, all day, every day since the vaccines came out. So I guess that's maybe this year, since January. And there came a point where it felt like I wasn't making headway. And we'll talk about this some more in a minute, but all these conversations in my practice are always grounded in relationship. And so if it's been enough said about this, then we move on and talk about something else that the patient wants to talk about that day. But I never let an unvaccinated patient leave without teasing them or asking if they have their shot yet, even if it's as simple as, dang it, if you had your shot, I could take off these stupid goggles. And that might not be all I say that time, but I never let them leave without the message of, hey, I really want you to get your shot. Some of the messaging that's worked for me is, I'll say, don't come to me for political advice. Don't come to me for real estate advice. Don't come to me for spiritual advice or to know how to structure a news segment. But please don't go to a politician, a journalist, or even your pastor for health advice. Come to me. I don't have any other agenda than keeping you safe and healthy. And for you specifically, I really think it's important that you be protected. Other things I'm seeing now, I'm seeing several people come in and say, I've changed my mind. And two things are changing their mind. One is the Delta. I think a lot of folks were going to ride the herd immunity thinking it was all over and they didn't have to get the shot. And as they see cases rising, they're going, okay, I guess I should do this. And the other thing is getting COVID. I have some really hardcore anti-vaxxers who have been super sick and survived. And now they're asking me how soon they can get the vaccine. And that's what we don't want to see. We don't want that. But getting COVID or having a loved one get COVID does seem to change people's minds pretty often.
Yeah, and so as Karen and I were talking about this discussion, and we talked about like, well, this is like kind of our job and our professions, whatnot. And so we approach these conversations a little bit differently.
Right.
But something that's important is that a lot of the evidence says that people are they trust their healthcare providers and their physicians. And so I think that something that Karen just said in terms of, don't come to me for spiritual advice or for political advice. Y'all can say similar things to your friends, in that you go to your physician for advice about all of your other health concerns. You talk to them about your hypertension or about your cholesterol or about the dizziness or whatever it might be. And COVID should be, you know, the COVID vaccine should be the same thing. Don't take your advice from Facebook or from politicians. You need to go to the people that you normally get your healthcare advice from. So that, I think, is an important point for those of us who are trying to engage, you know, more informally. All right.
Yeah. What does your doctor say? I like to use questions. What did your doctor say about that?
Yeah. Absolutely. And I mean, to be clear, we also know that there are some healthcare professionals out there that are not giving evidence-based
Yep.
advice right now. And that's not also what we can't solve all the problems tonight. We're just
And
gonna,
it's a small minority. They get a lot of press, but 96% of physicians in the United States are vaccinated.
yep. Okay, so moving on just a little bit here is that for folks who are this movable middle that we're talking about, who
Yes.
have questions, a little bit hesitant, but are open to learning more, these are the things that our science right now is telling us that they are concerned about. And so
Yep.
the more that we as individuals can be informed about these barriers, then the better off we'll be able to engage in a conversation with folks. And so, Karen, how do you kind of address this with people?
So I think number one is the most important, vaccine development speed. There has been this hugely reported concept that this was made in less than a year. That's actually simply not true. And so I give people information first. So if you have a pencil and you're taking notes, this might be some good stuff to jot down. Several reasons the vaccine was made quickly. One is that your body does most of the manufacturing, so the manufacturing process is very simple. Another one is that there's no virus in the vaccine, and so we didn't have to grow like we do with flu, 10,000 flu viruses in culture dishes for months and then weaken them or kill them. That step was not needed. This research on mRNA delivery has been going on for 16 to 20 years, not one. And I listen to a science podcast sometimes called America Dissected, and they had a really cool infectious disease doctor on. And he was talking about how this has been around for 16 years. So that all they had to do in 1 year wasn't come up with something from scratch. It was modify existing technology. And I think a lot of people understand that difference, coming up with something from scratch versus modifying existing technology for this virus. That was my biggest concern. And I tell them a story. You're going to find that there are people who are not linear, rational thinkers. Most human beings respond more to story than they do to statistics. And I don't like that, but we can leverage that. And so I tell a story that's a true story. I'll say, I heard this podcast, and then I was in a room with a patient. He's about 55, and I told him that, and he said, no, that's so true. My daughter works for such and such agency in Washington, D.C. for the government, and she approves vaccine. She approves biomedical research. And last year, she was screaming at the TV every time someone said this had been developed in 1 year, because she can remember funding this research 10 years ago. And so getting that idea out there that science is not instant, it's linear, and we've been working on this for a long time, and this was just the next step. So this stuff's been going on for 16 or 20 years, and it was adapted very cleverly, but it's not all new. I think that's really important. I do a little puppet show, and I'm going to do it for you if you'll forgive me for doing a puppet show on Zoom. I'm going to do my best because I only have 2 hands, but here we go. So if you have a cell in your body, can you see this? Okay, yeah. And then you have a nucleus on your cell. In the nucleus, it's like a vault. And in here are blueprints for the whole body. So if your body was a hotel in Vegas or a palace in Europe that had 1,000 rooms, every room would have a vault with blueprints for the whole building. And that would be pretty good Ocean's 11 movie, I think. a vault in every room with blueprints for the whole building, but there's also this other organelle in the cell, forgive me for taking you back to high school biology class, called the endoplasmic reticulum. And the endoplasmic reticulum is basically a factory. And so what I have blueprints in a vault, and I have a factory, and nothing's happening. So what God did or what evolved, take your pick, I don't care. I'm into both. There's a shuttle, and the shuttle comes along, and it comes over here, and it says, hey, what are our orders for today? And the vault opens up just a little and says, just this piece. Okay, copy, 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 got it. Come over here to the factory and go, hey guys, here's our orders for the day. We have a job. Oh, cool, work, work, work. Send that out into the body, and the body says, thank you very much. And this gets disassembled into its building blocks and recycled. That's what mRNA does in your body, just at a conceptual level. So what happened 16 years ago over in Asia, some genius figured out how to take this out of a cell, out of a virus, out of the SARS virus, clean it all off so there was no virus left in it, and then sequence it and figure out what's on it. And then they spliced it, and they just cut it to this little piece right here. And all it codes for is one protein on the virus's coat. You can even think of it as one plate in its armor. We took this and made billions of copies of it. And we have this fancy biological copier called PCR that can make millions of copies in a day. We put this in there and it makes a bunch of copies. We take our copies and put those in the shot. Now, they come into your body. Here comes the little copy, just the little piece. It doesn't go here. It doesn't reprogram you. It doesn't give you a micro machine or turn you into a Bill Gates liberal. It doesn't even go here. It's already got its orders for the day. It goes over here. Hey dudes, here's our orders. Oh, work, good, we have a job. Make it, make it, make it. And they send it out to the body, and here comes that protein out to the body, and the body goes, ugh, stranger danger. I don't know you. And some people, I'll tell them the body's worse than a gated neighborhood for hating strangers. And then if the virus comes in with the protein on its coat, it'll attack that. And so now you're immune to COVID without ever having had any virus at all injected into your body. I love the mRNA vaccines because there is no virus in them. So that's my little puppet show that I do over and over for my patients. And then I try to answer their questions, and we'll talk about this in a minute. But the first thing I say is, what are your questions? Oh, I noticed you don't have your COVID shot. Do you have some questions? And they'll go, no. And I'll say, well, you know, this is the place you should get your medical information. Don't come to me for real estate advice or politics. But I am the person you should maybe get your medical information from. And I'd like to answer any questions or concerns you have, or at least look at them. And we go into it. And we've had some people change their mind more in the beginning, but I'm still having some now. And so I think this is the key piece. If they're not open to it, I leave that seed planted for that day and move on to their blood pressure and keep the relationship strong and connected. And then the next time they come in, I go, hey, did you ever get that COVID shot? Oh, do you have any questions? What questions do you have today? I think the other thing I'm hearing right now, the big piece of misinformation right now, is that it's not authorized. No, that's not right. And not approved by the FDA. It's not FDA approved. And I say, right, because FDA approval is a 3-year process. But it is authorized by the FDA. And that's not a small thing. This isn't something that someone did with a handshake over a cup of coffee in a back room. I'll give you an example. For Pfizer, they had to enroll 40,000 patients for months and collect all the data on side effects and effectiveness before they could get the emergency use authorization. If you'll remember, the emergency use authorization took months, like 8 months. And the same thing for all the other companies. So there's a whole lot of data out there. There's enough data for a reasonable country to have already approved it. We just have a lot of bureaucracy in America And we're super slow to approve anything. Everybody hates the FDA. They want to approve your chiropractor, and I'll say things like that. They want to approve your essential oils, You can tease a little, but you have to know your audience. But I think it's important to know the difference between FDA approved and FDA authorized to save lives in an emergency. This was very well studied, almost too well studied. We really slowed it down. So sorry, that was probably more than you bargained for, but on that point, those are the things I'm hearing. I'm hearing it's not FDA approved and it was made too fast. So I tell them about the science girl who's a daughter of a patient who throws her shoes at the TV because she funded it 10 years ago. Because for these people, story is more powerful than statistic. I do know the statistics. I could quote you some of the statistics, but these people aren't listening to that. But a story, oh my gosh. I happen to know that story is really powerful. So when I got my own shot, I went on Facebook on all these Mainer pages we have over here. We have like 5 different community Facebook pages. And I was really scared to get my shot because I'm allergic to shellfish, too much information. And this guy last week who was a doctor is allergic to shellfish and he had a bad reaction and I was scared and I took my Benadryl with me. And you know what? Nothing happened. And I'm so excited that I got my shot. And I had 5 people direct message me and say, oh, thanks for saying that. I'm going to go get mine now. And I wanted to go, that's not why you should get your shot. But I'll take it if it works. So remember that the power of story and emotion for this crowd may be more important than the power of fact.
That's really helpful, Karen.
Yeah. Thank you, Sally.
Yeah. Thank you, Karen. So this is kind of a little bit more building on what Karen just walked us through, but in terms of what the kind of market research, if you will, tells us works right now for messaging that resonates. And I think this point down here at the bottom is that we're trying to have a dialogue and we're not debating people. And something that Karen just said, I think is another super critical point, is that if someone says no, absolutely not, leave it. And then the next time you talk to them, you can ask them, have you gotten your vaccine yet? And they might still say no, but the point is that you don't forget about it. It's just that you don't push them in the moment in which they are not ready to engage. Because what happens then is that the conversation is stopped and you will not be able to reopen that door. So leave the door open for the next time. So here are some of the things that we know works. I mean, is helpful, I guess. So we validate that people have concerns and questions. We don't tell them that they're stupid for having them because, we know that this works and they tell us that it does. No, we validate and acknowledge that it is okay to have questions. And then just like Karen walked through, scientifically based, but plain language answers. And if you don't know, because some of that is still not super plain language, you can say, well, you could probably really talk to your doctor about it because they're going to be able to walk you through this really much more easily than I can. But here's what I understand to be true.
Yeah, or that's a great question to ask your doctor. You should ask him that.
Yep. And so then the next big thing is to reference the things that we all miss the most, or that your loved one or colleague or whatnot really misses. And this is like when Emily introduced the session earlier, that we got used to being away from each other, and then we got used to being back together, and now here we are again away from each other again. And so you can reference this, that we are all tired of the pandemic. We miss human connection, we miss the things, and the vaccination is a pathway to the possibility of regaining those important moments that we miss. Protection. So this is now, becoming, we realize that vaccines are not just for ourselves. Vaccines are for all of us. They're for the community. And what we know doesn't work is saying things like coming together as a nation, or that this is the right thing to do. What we should say instead is that you're going to protect, I can protect myself and my loved ones. I can protect myself and my kids who are too young to be vaccinated.
Whitney, that's been very helpful right now. It's a very timely message because everyone's been worried about the kids and the back and forth politically on the mask and the schools and who controls those rules is in the news. And I've been telling young mothers, the best thing you can do for your baby is get vaccinated. The best thing you can do for your kids going off to school is get vaccinated. I think that's critical. Yeah.
Absolutely. And this is very similar to our approach for pertussis or whooping cough, in that babies up until the age of 1 are not able to be vaccinated, and pertussis is a very, very dangerous illness for babies.
Yeah.
And so if you call up the health department and there's an outbreak of pertussis, what they're going to say is you need to vaccinate all of the parents.
Yep.
Because that's what we do. We cocoon the babies. We cocoon.
It's called cocooning. I love it. And a lot of OBs will do this at the end of a pregnancy. They'll start saying dad, mom, grandparent, anyone who's going to babysit needs to have their pertussis shot, because that baby can't get it, like she was saying, until they're at least 2 months old. Yeah.
Yeah. And so, and I think that, there's less research, but I think like intuitively, anecdotally, it kind of helps to reference, this is not new. This is not something that we do new with the COVID vaccines. This is how we protect kids from childhood illnesses, even before COVID. We vaccinate adults until they're old enough. Okay. And so then, of course, being positive about this and refraining from calling people names and all of that kind of stuff is very important, but inviting, respectful, and not like expecting or demanding things. And at the end of the day, nearly every suggestion page that you go to will end with acknowledging that the choice is that person's. And of course, we're coming away from that a little bit because we're starting to see more mandates, but this really resonates with people who, we value liberty, freedom. And so this is an important choice, but it's your choice.
Yeah. And not just the words. I like that they put tone. People know if you freeze up, and they know if you disapprove. So you really got to control this and this and this, because if there's a negative emotion associated with the conversation, it puts another obstacle to coming to agreement or to changing their mind. So you want to say, okay, I get it. It's my job to tell you. And I tell you because I love you. And I'll stop bugging you. I say things like, well, I'm not going to follow you home and stab you with a needle. So it really is your choice. I tell people that about their medicine too, all the time. I'm not going to follow you home and shove pills in your mouth. So ask me your questions now. Yeah.
All right. Okay, so then here in contrast, and this is just kind of the counterpoints to what we just walked through in terms of the messaging that resonates. And here's what we know doesn't really resonate. And we talked about like the negativity and fear and the guilt just is not helpful and doesn't work. And honestly, too, this fear, there is some research that tells us that a lot of people up until this point have been somewhat hesitant or not gotten the vaccine yet because their lives weren't affected by COVID, the illness. Right. It was affected by COVID, all of the things that came with it, but they personally weren't sick. They didn't know people that were sick. And so trying to reinforce that COVID is bad and dangerous does not resonate with them because that's not been their experience. And so keeping things positive, reinforcing the safety of the vaccine, the things that we just talked about is more effective. Okay. And so then these last two, I think are important as well in that, we don't want to overpromise. And this is kind of where we see ourselves now in that we were told that we vaccinate people and it's done. Like if you're vaccinated, take your masks off, you're free to go. But that's not, unfortunately, how it works. And so we now see that we don't want to overpromise. And we also want to avoid saying things like getting back to normal, because there are, in contrast to the people whose lives have not been affected by COVID, there are many, many, many more whose lives have been deeply affected by COVID and will not be going back to normal ever.
Yeah, and in Austin, if you're a musician, a bar owner, or a restaurant owner, you've probably lost your business by now, and COVID may not have touched you. So there's already that, hey, you guys are killing me with all your bossiness, and it's a real thing for them. So yeah.
I think is there a question in the chat? No. Okay.
Someone had to leave.
Oh, gotcha. Okay. Goodbye. I missed. Okay, great.
Sally asked a question
Oh,
earlier
there-
about how to talk to the unhoused women in our ministries.
Oh, sure. Yeah. So hopefully some of this is helpful for that specific audience as well as kind of more broadly.
And Sally, one thing I come back to a lot with all vaccine conversations is I'll use this sentence a lot because it shows a lot of respect. I'll say, when I talk to people who have hesitations about any medical thing, XYZ, I usually find out that they have really smart questions. What you might not know, maybe no one has given you this information, is that there were often studies done 10, 20 years ago, like for measles shots, right, that answered those questions. Some other people have had the same questions and they've been working on finding out the answers. So why don't we dig into that? But the idea that, you know, you're a smart person because you ask questions, I think is super relationship building and disarming, and it helps people be open to what you have to say.
Yep. So I'm not sure that there's much new on this slide here, but just really, again, reinforcing, validating what people may be thinking and feeling, and this kind of how to frame, how to approach talking with folks. I'm gonna, let me see here.
Oh, yeah, we were going to talk a little bit about the evangelical mindset.
Yeah.
Do you have something else you want to go through first, Whitney?
No, I think that this is a good time. I'm going to go ahead and.
Okay, so some of you guys know, and I know Sally knows, that I was raised evangelical and anti-medical, which is kind of fun because I was called to be a doctor when I was 7. But I wanted to talk, and I touched on a little bit of this earlier, this culture, and now you can't put everybody in one box, obviously, but large swaths of Texas are cultures that are not what we would call rational and fact-based. They're emotion-based, loyalty-based, and moved by story rather than by statistics. And so if someone's coming to you out of a deep-rooted anxiety that, I'm just going to go there, that they're a huge Trump supporter because immigrants have taken over our country and are threatening their livelihood, that's a real concern they have that causes them to identify with a big group. And that big group is putting out a lot of misinformation right now. They're pushing back on, I mean, some of these folks that make a lot of money doing media, not news, are talking about vaccine related deaths every night. And there have been a lot of things reported. The perspective is, 8 million J&J vaccines and 6 people with blood clots, but they'll just talk about the 6 people with blood clots. So they're putting out messages that are different than the facts. But we were told growing up that we were the only people who followed God, that we followed God, that other people didn't, and that following God was worth dying for. And I think a lot of us could agree with some of those thoughts. We want to follow God and it's worth dying for. So I think approaching people with respect, but being aware of that subculture, that anti-science subculture, and not coming off like a scientist, but instead like a concerned neighbor or a person with a story. Because if they're responding from the gut, you can't talk to their brain. You're going to have to talk to the gut. And I think that's important. When I was a young evangelical, I would interpret anything emotional as spiritual and as coming from God. So if I got nervous hearing a vaccine lecture, I would say the Holy Spirit is telling me I shouldn't be listening to this. Well, the reason I was nervous was because I had been trained in Sunday school not to listen to this, right? So all of that is going on. People's lives are complicated, but you can talk to people based on your shared faith, your story, and the stories you've heard, and then connecting to them at a gut level and emotionally in positive ways. And I thought that was maybe helpful for some of you. I think of subcultures as the icebergs below the surface. When I'm in a medical interaction, someone might look just like me, but have been raised Seventh-day Adventist and told to never take a medicine. I don't know that unless I ask. And it's the iceberg that sink the ship. So be aware of some of those things. And that's why I think it's important that we communicate at all levels, rationally, emotionally, and with our stories. I think that's all I really have. Oh, they've also been taught that science is the enemy of faith. And they want their faith. And that was something we can respect and encourage, that they want their faith. And then we have to gently come sideways at the other stuff. I think that's all I have on that, Whitney.
I think that's great. It's super helpful. And it's always hard to remember that people are full
Trained
people.
differently.
Yeah.
People are trained differently than we are. And it's not their fault how they were trained.
Yep.
Be patient with them. Yeah. So you don't know what iceberg you're navigating. That's why you tread lightly.
Yep.
Maybe they were abused. And if they feel like you're being bossy, that triggers that.
Mm-hmm.
There's a lot of different kinds of icebergs. So you want to tread lightly, especially if people over respond.
Yeah. Okay. There were really just kind of two big points left that I want to make before we just kind of close with discussion questions that anybody might have. And the first was about kind of workplace policies, and this may or may not pertain to you, but perhaps you're married to someone who it does, or your friend or whatever. But I think Karen mentioned earlier that, or I don't actually, it might have been before the session actually
We were
started.
chatting, I think.
Yes. That one of the big reasons that people still give for not having gotten vaccinated is that they are worried that they will not be able to take time off of work to recover from side effects. So people for whom they don't have PTO, they're hourly workers, they cannot afford to miss the day's worth of wages or whatever it might be, just can't afford to take the time. And so one workplace policy that can address that is to give people PTO specifically to get the vaccine, and then time if they need to recover from the side effects.
And pay.
I'm sorry, go ahead.
And pay.
Yes, paid time off. Yes. Yep. And so another policy that I know has been introduced locally in some places is that the company had dealt with a lot of COVID illness and COVID related absences amongst their workforce, and still dealing with a large unvaccinated population. And so they have switched to, they will no longer cover PTO for COVID related illness if the employee is not vaccinated. So they're not mandating vaccines, but
Wow.
they brought a COVID clinic to the work site so that people could get vaccinated on site, had an informational session about the vaccine, answered questions, and then said, it's your choice. You don't have to be vaccinated, but if you get COVID, you're not going to be paid for your, sick time. So that's a little bit of a harsher, carrot or stick, I guess, but something that could be considered. And then of course there is just vaccine mandate, if you want to work here, you are going to get vaccinated. And there are lots of reasons that people might not feel comfortable with doing that right now, but that of course is an option.
And we've had vaccine mandates forever. Your vaccine passport is your shot record to go to kindergarten.
Yes.
So it's not new to mandate vaccines, right?
No.
Adults aren't used to it, I think. But yeah.
Healthcare workers should be, because we have all sorts of vaccines that we have.
I used to call it the yellow mask of shame.
Yeah.
I always knew if a nurse in the hospital had chosen not to get their flu shot because all winter long they had to wear a mask. Now we all wear masks, you know, but you always knew who didn't want their flu shot because they had to wear the yellow mask of shame all year. Yeah.
Okay, so those are some suggestions kind of for workplace things. And then the last big point, this is just this, we do not have enough time to talk about vaccine misinformation and disinformation. That's a whole other thing. But I think an important point, just for those of us here, is that we do not want to ever kind of inadvertently perpetuate bad information, and social media makes it so easy to do that. And so something that I've just heard recently is that if you are not sure, don't share. So that means if you cannot validate the claims and whatever it is you're going to be sharing, don't share it, because it could just be a little bit off, and yet a little bit times however exponential growth, we know what happens to that. So
or you lose trust when you're trying to gradually, every conversation, slowly convince someone. You can lose their trust by telling them something untrue.
Yep, exactly. So that's kind of the only point about that right now that I wanted to make, just so that we are aware of, that, kind of our role in that kind of the misinformation pipeline. I don't know what it's called, but
yeah, web.
Yeah, there you go.
I had a patient the other day tell me she's not getting her vaccine no matter what, and this person really needs the protection. And then she started telling me that she's an independent, and I don't know why people feel the need to bring politics into it. So when someone is talking about the vaccine, they tell me they're an independent, I already know they're actually a conservative. Not that there's anything wrong with being a conservative, but and she had heard from Drudge Report that there was a number somewhere out there from someone reputable that the Pfizer vaccine was only 46% effective, and it had been all over the Drudge Report. And I hadn't heard that at that time. And I said, I haven't heard that yet. Let me check into it. And the other day I found it, and there was a study where in that study, the Pfizer vaccine was only 46% effective against getting COVID, but it was still over 85% effective against being hospitalized or dying. So what if I had said, oh no, you are wrong, we would have been in trouble. And it sounded wrong. It sounded like she was wrong. I hadn't heard that number before. So that was, yeah. Take yourself with a grain of salt. You might be wrong. You might have heard something wrong. I think humility just goes so far in these conversations. If people get the idea that you're saying this because you're smarter than them, or you know more than them, or you're better than them, even if you don't mean it to come across that way, they're just naturally going to resist. I mean, I resist that. But I would just go back to the fruit of the spirit that I had to memorize in NYF when I was a kid, love, joy, peace. How can you do this with love, joy, peace, patience, goodness, and kindness? How can you infuse this conversation with joy and peace and friendliness, even though you're talking about something you disagree about? Do you want to open it up to the gallery and just talk? Let's do that.
Yep.
Emily, is that doable? There we are. Hi, everybody. Okay.
I was just going to say that I have a friend in Dallas, and it's the Dallas Bar Association, and it's their, it's not the lawyers, but it's the people that run the association. They actually gave $100 bonus to each employee who would go get the vaccine, which sounded like a great idea, and it worked pretty well, except for the few people who didn't want to get it. There was a lot of pushback from them. And I don't remember what, I didn't get into it with her, so I don't know like what their reasons, they might have had some exceptions or something, but they wanted to know why they didn't get a bonus. And they were saying, well, you didn't get the vaccine. So it was just kind of an interesting workplace solution for them,
Yeah. I think that's a great point. Yes. I think maybe Dallas School District is doing the same thing, and that they're offering $500 bonuses for their teachers to get vaccinated.
Now that'll make up for a couple of days off work.
Yeah.
Okay, what would you say to, I know a friend, her granddaughters are 22, two of them are 22 and one's 23. They're not going to get it because it causes them to be infertile. They really believe that. What?
They really believe that. It has been debunked. I think I might Google around for some articles on that.
Okay, it has been formally debunked. I mean,
It has been completely debunked, I think 3 times now. So CDC website may have the links, Jenny, to that.
okay.
Yeah.
And I think
What-
one specific thing that might be helpful is to note, and I don't remember the numbers right now, is that there were several women who actually became pregnant during the trial, even though they were like, as a condition of enrollment into the clinical trial, they had to be on they said we are on birth control, 2 forms, and they still became pregnant. And so like, that's just, you know, an anecdote, but again,
A story. That's a good story. Yeah. That's a great story. Yeah. Yeah. Like that.
That might lead people to say, I'm afraid to get it because I might get pregnant.
It's going to make 2 forms of birth control not work. There was a lady, we did a thing out here in Manor. In the beginning, for some reason, it was hard to get shots over to the east side. I don't know why that is. It's something we work with all the time. But we worked with Andy Brown and our mayor out here, Larry Wallace, and they got us 4,000 doses. And my volunteers, I run a nonprofit in my spare time. We gave out 4,000 doses in April and the first weekend in May here at Manor. And there was a woman she was in her 30s or 40s. And she said, I don't know if I should get this because I'm breastfeeding. So she was an older mom, but she was a new mom, had a breastfeeding infant. And I said, well, I've read some recent studies that the antibodies actually pass into the breast milk and protect your baby. And she broke down crying, and I had to hold her for 10 minutes before I could give her shot because she was so relieved. She said, I didn't think there was anything I could do to protect my baby. I've been so scared. I've been home for 6 months trying not to go anywhere because I don't want my baby to die. And the idea that she could do this and pass that immunity to her child was everything to her. And protecting your baby in the womb is where I go with pregnant people. Yeah.
I have a question. And it's not that I want to argue the point at all. I'm just very curious. I hear this multiple times from folks that they have a medical condition that prohibits them from getting the vaccine. Are there medical conditions that exist that should exclude people from the COVID vaccine?
Of course there are, but there are very few. Allergies to the first dose of the vaccine. I have one lady I had to tell, don't ever get the second dose. In the 4,000 shots we gave at Manor High School, 1 had an allergic reaction.
Okay.
So that's one. There's some thought about Guillain-Barré, but I don't think it's really been formalized. Whitney, do you know if that's a contraindication?
Maybe for the Johnson & Johnson vaccine, but that is, I'm not sure.
So what I do in those conversations, and you could maybe modify this, people will say, well, I have lupus, or I have this, or I have that, and I'm scared to get the vaccine. I tell them, well, let me message your specialist, your lupus specialist.
Yeah.
And at Scott and White, I have the luxury of instant messaging with my specialist. And they'll write me back the same day, and I'll send a note back to the patient. Hey, I heard back from your rheumatologist. And here's what every nephrologist, rheumatologist, specialist that I have talked to for people with serious diseases has said. The vaccine might be hard. It might make your fibromyalgia flare. It might make your rheumatoid arthritis flare. But that means that for you, COVID would be 100 times worse. So please go ahead and get the shot and be prepared for the flare. Because COVID does a lot of its evil by overstimulating the immune system.
Right.
So any side effect that the shot might give you is going to be so much worse. And those are the very people we're trying to protect. Whitney, do you have some thoughts on that?
Yeah, no, not. I think that point there at the end is that folks with those conditions are the very ones who need the protection the most. Yeah.
What
Just
was
stock up on
kind of-
ibuprofen. Yeah.
Oh.
Go ahead.
what kind of allergic reaction did the person have? And was it something that it wasn't worth them going ahead and getting the second shot?
It was my call. It was my decision to make. I was the medical director of the site. I was the only doctor there. I had 100 volunteers, the school police force, the town police force, and the EMS helping me. It was great. But I told her not to. She had gone home and had lip swelling and tongue swelling and not told anybody, and turned out okay just by good luck. And so, yeah, anaphylaxis, no, we don't do it again because you could die.
Well,
Mary
I
Faye-
worked at the Delco vaccine site. I worked for City of Boston. I worked for the library, and while we were
Oh,
closed,
thank you for working the Delco site. That's so great.
we all had to go someplace else.
Yeah,
because
yeah.
we couldn't be at the library. And it, you know, they kept people who started having those kind of, I mean, everyone had to stay for like 30 minutes and,
Right.
and, you know, I'm just wondering if it was caught and EMS was there to help you, if it wouldn't be worth it to go on and get the second shot. But I
So
mean,
there's a
you're the
vaccine
medical-
information sheet for most vaccines. We don't have one yet for the COVID vaccine because it's not formally approved with the 3-year process yet. But there is data out there, and a previous anaphylactic reaction to the shot or one of its components is actually a contraindication.
Oh, okay.
There are no 100% or 0% in medicine or science ever. You know, there's going to be something, and that's why we ask all those questions, and our nurses ask all those questions before they give you the shot. There's reasons for all those questions, and every now and then, she had a type 4 delayed hypersensitivity reaction, which that means is like it had started several hours later, but the symptoms were pretty classic, and so she was past her 30 minutes when it started.
Yeah.
Yeah.
But Mary Faye, I think so. In terms of an allergic reaction, it's the anaphylaxis in which your throat
Right.
closes.
Right.
That's the contraindication, because there are a lot of other folks who because Moderna had a pretty significant number with a rash, like a bad rash that people would get on their body that was not pleasant and was not comfortable, but was not a contraindication for getting the second dose. And so there are other reactions like that is not a contraindication for the second dose, but
Only your throat trying to swell shut and
Yeah.
suffocate you. That's the only
And
one.
I know I'm allergic to sulfa and penicillin, and I know that's not a good, that's
You
not a
get
good
it, yeah.
feeling.
Well, what would I do if I knew I was allergic to it? Would I take an EpiPen and some Benadryl and go get it anyway? I don't know. Probably not. Probably not. I took an entire bottle of Benadryl with me because we were some of the first vaccinated and no one had it yet. And I have a horrible shellfish allergy that's tried to kill me 2 or 3 times in my life, with my throat swelling shut and my eyes literally swell shut, and I look like a creature from a Bad Moon movie, you know. I took a giant bottle of children's Benadryl because the liquid absorbs through your cheeks and you don't have to wait for the pill to dissolve. And I had it in my purse ready to go and nothing. So that was great. But yeah, there are very, very few reasons not to get it, but that's why they ask the questions. Mary Faye, you work at the library?
Yes,
Do you know a woman named Kimberly Francisco?
I've seen that name.
She's yeah, we'll talk later. She's my
Okay.
daughter-in-law. Yeah, yeah.
Oh, right.
She just married my son. She works in the young people's literature, does the purchasing for the teen books.
Mm.
I saw Kathy raise. It is 7:30, so I want to honor the time here, but maybe we'll take
Kat. We'll
last
take Kat.
question.
Mine's not a question, but more, I guess, an encouragement. I kind of had a realization this morning, because like y'all who are here to hear this conversation, it's very frustrating right now with the people who are unvaccinated. And in some ways I've kind of been like, well, I'm not going to change their mind, or it's done. And just this morning at the breakfast, I had two gentlemen I was visiting with. One was I was handing out socks and just talking with him. And all of a sudden he held up his vaccination card and said, I'm going to get my second shot today. And I was like, well, all righty then, and talked to him. And then the other guy said, yeah, I got mine 3 weeks ago. So here were two gentlemen recently vaccinated. And it's Delta. I mean, they're starting to kind of be like, okay. But it just gave me that thought of, okay, now before Delta, I felt like it was not worth this stress, the anxiety of having the conversation.
Exactly.
But now I think there is that movable middle, I think is more movable right now. So I hope I'm including myself, we will have those conversations. I'd love to I want to type up some of this stuff to have a little cheat sheet with me, because Tuesday I talked with the gentleman who was talking about the virus being live and in the thing. And I'm sitting there going, wait, I don't think that's true, but I can't, I'm not medical. And, but to have the information and be like, actually, and check it.
There's no virus. This is the first vaccine ever with no virus in it at all.
And that was his big fear. And he'd had a dream the night before about it. And I'm like,
oh,
yeah. So now I want to circle back to him and say, aha, I know now.
Yeah.
I think the movable middle is going to be moved by relationship.
Yeah.
Not by
Kathy, I'm going to make a little sign we can put on each volunteer tomorrow morning at the showers that says, yes, I am vaccinated.
Mhm.
We'll notice that every one of us there as volunteers are
a great idea.
That's a
I
great
always say I've had both shots and I'm fine. I'm fine. Yeah.
Thank
Yeah,
you. Thank you both.
I mean, I think
Yes.
that the last thing that I'll say is to acknowledge that this is really hard. Like, this is very hard work. And I think that, and I am grateful for each of you that took the time to come, because we need everybody to try, and even though it's really hard. So thank you very much.
Here's my
Whitney,
cynical side.
Karen, I can't imagine how frustrating for the two of you, because it's
We
frustrating
are,
as a
yeah,
layperson.
Sally, we're in the middle of an optional pandemic.
Yeah.
When you opt out of the
Yes.
shot, you're opting your neighbor into the pandemic. And that's not going to be helpful in these conversations, but that's my cynical side. I am so frustrated with my patients' family members dying and picking up the pieces when every one of them is preventable. Yeah. Yeah, I won't lie, I'm frustrated. But you go back to love, and people have questions and concerns.
Thank y'all so much.
Thank you very, very much.
Thank so
you.
helpful.
We appreciate you and all the work that you do for this community and church, and this was really helpful.
Yeah.